Today we are going to discuss about peripheral nerve diseases after so much time. So let's discuss without any delay. Okay. Peripheral nervous diseases may affect the motor, sensory or autonomic components either in isolation, only one component of these may get affected, or in combination. Okay, site is now root if it is involved, radiculopathy will call, now plexus involvement plexopathy, and if whole nerve is involvement it is known as neuropathy. Neuropathies are mononeuropathy and multiple neuropathy. Multiple neuropathy is mononeuritis multiplex or symmetrical polyneuropathy. Pathophysiology: damage to the nerve cell body which is axon or myelin sheath which is quad cell. Okay, axonal or demyelinating neuropathies we will call this as. So if the myelin sheath is involved, then we will call that as demyelinating neuropathy. If nerve cell body is involved, then we will say it is axonal neuropathy. So what are the causes for it? Okay, you can remember like Duramap. Okay, like axonal if it is, D for diabetes mellitus, R for alcohol, means in chemistry language alcohol, U for uremia, C for Durkam-MAP. So C for cirrhosis, A for amyloid, M for myxedema, another A for acromegaly, and P for paraneoplasm. These are the causes for axonal damage due to the peripheral nerve disease. Okay, so what are the drugs involvement? What drugs may cause peripheral nerve disease means amiodarone, antibiotics like dapsone, proton pump inhibitors, metronidazole, ethambutol, like these drugs, antiretroviral chemotherapies, cisplatin, vincristine. Okay, phenytoin, okay, thalidomide. These are the drugs which cause peripheral nerve disease. Toxins like alcohol, nitric oxide, and rarely lead, arsenic, mercury, OP compounds, and some solvents may also cause this peripheral nerve disease. Deficiency states B1, B12, thiamine deficiency, B12, cyanocobalamin, pyridoxine, vitamin E, and hereditary factors. Some infections like HIV, brucellosis, leprosy, and some idiopathic, which are causes unknown. So coming to demyelinating causes, these are all axonal causes, axonal neuropathy causes. Coming to demyelinating neuropathy causes are chronic inflammatory demyelinating polyradiculopathy, means nerve root involvement is there, and multifocal motor neuropathy, paraprotein associated demyelinating neuropathy, Charcot-Marie tooth disease type 1 and type 10. Coming to clinical features, motor neuron involvement if it is there, element lesion, then signs and symptoms may depend upon the sensory nerve involvement. Small fiber neuropathies will be painful. Autonomic nervous system, which is if it is involved, then there will be postural hypotension, sweating disturbances, cardiac rhythm, and GI, bladder, sexual dysfunctions. Okay, if there is any autonomic nervous system involvement is there. Okay, coming to the continuation of the cause, genetic causes will be there. Charcot-Marie tooth disease, hereditary neuropathy with liability to pressure palsies, and hereditary sensory plus autonomic neuropathies, familial amyloid and amyloid polyneuropathy, hereditary neuralgic amyotrophy. Okay, what drugs may cause demyelinating neuropathy means amiodarone, same, it is common to axonal and demyelinating. Antibiotics like dapsone, proton pump inhibitors, metronidazole, antiretrovirals, chemotherapy with cisplatin, vincristine, okay, thalidomide, phenytoin. Okay, these are some common causes for both. Toxins are also same, vitamin deficiency same, and infections HIV, brucellosis, leprosy same for both demyelinating and inflammatory causes are Guillain-Barré syndrome, chronic inflammatory demyelinating polyradiculopathy, vasculitis, polyarteritis nodosa, granulomatosis, and granulomatosis with polyangiitis, rheumatoid arthritis, SLE, paraneoplastic, which are antibody mediated, systemic mediated conditions like diabetes mellitus, rheumatic fever, sarcoidosis, malignant diseases with infiltration. Others will be paraproteinemias, amyloidosis, initial illness, some illness, and polyneuropathy or myopathies. Okay, What investigations you will do? You finally you knew the causes. What investigation you will do? Initially you will test for RPS or FPS to know glucose, to rule out any diabetes is there or not. ESR, CRP to rule out any infection is there. Full blood count, urea, electrolytes, LFTs, serum protein electrophoresis, vitamin B12, folate, ANCA, and DNA titers, CXR, chest X-ray to rule out any pneumonia, any respiratory causes there. HIV testing, initial tests if they are negative. If you are still suspecting neuropathy, you will do now conducting studies, vitamins, vitamin E, vitamin A, vitamin B12, like that, genetic testing. Lyme serology, serum angiotensin converting enzyme levels, serum amyloid. Coming to entrapment neuropathies, these occurs in case of diabetes mellitus, alcohol, toxins, or genetic syndrome. If axonal loss is not there, and entrapment neuropathy recovery may occur. If there is any axonal loss, then this may become irreversible. Okay, so we should avoid the precipitation of activity by surgical decompression. If you do any surgical decompression, then neuropathy will not occur. Okay, coming to signs and symptoms in common entrapment neuropathies. If median nerve is involved, we know carpal tunnel syndrome, right? Symptoms will be pain and paresthesia on the palmar aspect of hands and fingers. Okay, waking patient from the sleep. If you wake the patient from sleep, he may complain of pain and paresthesia on the palmar aspect of the hands and fingers. Okay, the pain extends to the arms and shoulders. Muscle weakness or wasting. Muscle involved is abductor pollicis brevis. Area of the sensory loss is wherever the median nerve supplies, those area will be there will be sensory loss. Lateral palm, thumb, index, middle and lateral half of the fourth finger. Coming to ulnar, paresthesia on the medial border of the hand, wasting and weakness of the hand muscles. All small hand muscles excluding abductor pollicis brevis. Medial palm and little finger, medial half of the fourth finger, there will be area of the sensory loss. Okay, it was. Coming to if there is any radial nerve involvement, weakness of extension of the wrist and fingers, often it is precipitated by sleeping in abnormal posture. Like Saturday night palsy, the alcoholic patient with the hand extended above the chair, then there will be radial nerve palsy there, right? Wrist and finger extensor supinator are involved. Dorsum of the thumb, okay, will be affected. Wrist and finger extensor supinator, the radial nerve will be supplying. Okay, dorsum of the thumb will be affected. Okay, common peroneal nerve, there will be foot drop, trauma to the head of the fibula, dorsiflexion and eversion of the foot is done by common peroneal nerve. Now, dorsum of foot will be affected. Lateral cutaneous nerve of the thigh, myalgia paresthetica, tingling and dysesthesia on the lateral border of the thigh. Okay, and lateral border of the thigh will be involved. Coming to multifocal neuropathy, which is known as mononeuritis multiplex, lesions will be multiple nerve root, peripheral nerves. The cranial nerves will be involved. Vasculitis, common cause of systemic diseases, or isolated to the nerves. Okay, motor multifocal neuropathy, there will be conduction block in case of rare, like in pure motor neuropathy, there may be conduction block, which is associated with the GM1 antibodies, which responds to if you give IV immunoglobulin, patient will get recover. Okay, causes are axonal, vasculitis, diabetes mellitus, sarcoidosis, and infections like HIV, hepatitis C, Lyme disease, leprosy, and diphtheria. Focal demyelinating without conduction block. That is multifocal mononeuropathy, multiple compression neuropathies. Okay, and peripheral neuropathy, like that. Okay, If there is conduction block along with the multifocal neuropathy or mononeuritis multiplex, this is known as pure motor neuropathy, which affects the arms also, which is associated with the GM1 antibodies. Then the treatment will be probably IV immunoglobulin. Polyneuropathy, length dependent pattern, longest this polyneuropathy is first distal lower limbs will get affected. This is all about peripheral neuropathies. Mononeuropathy, polyneuropathy causes based on the side, root, plexus and nerve involvements causes in axonal and myelin. If myelin sheath is involved, the causes will get differ. Okay, and some common causes are alcohol, nitric oxide, vitamin D deficiencies like that. Clinical features based on the involvement of the area. If there is any element vision involvement, if ANS involvement is there, postural hypotension, sweating disturbances, okay, cardiac rhythm, GI, bladder, sexual functions will get affected. Okay, this is like commonly investigations what you will do. Entrapment neuropathy in case of diabetes, and this carpal tunnel syndrome is very important there. Um, that's it, guys. Mainly you have to know about this entrapment neuropathies and causes of the peripheral nerve disease. Okay, thank you guys. Meet you in next video. Thank you.